We decided to do a collaboration with Justa Center. We're able to expose students to working with people who are experiencing homelessness. They're able to not only hear the stories of these patients, they're able to also understand some of the socioeconomic factors and social determinants of health.
So our nurse clinic is integral to what we do. We don't want our members ping-ponging around the system. And having the nurse student volunteers is a great addition to our staffing. A lot of our members have physical and mental health challenges, so we're trying to expand our nurse clinic capabilities to have more integrative care.
I think it's very important for students to be able to have access to a variety of different populations, settings. You need to learn the barriers of which people are experiencing. This could mean their barriers to how they access medications, how they have access to healthy foods. If people aren't in a position where they have access to these things, you have to be able to learn how to navigate and work with them and what they do have.
We practice evidence-based healthcare, period. The way that we do it can be a little bit different. As we continue to grow our nursing workforce, we must have a nursing workforce that truly understands homelessness. Even the students who come in and seem most uncomfortable in the situation very quickly realize it's just people. And so then we move forward from there.